open, we just don't have a central message coming from higher up to do, let's follow these 3 steps. I mean, we know what they are: the social distancing, wearing face masks, disinfecting, but how does that play out in real life as we reopen? And as you said, we go to barbecues and we start expanding our bubble, our quarantine bubble, as these restrictions are lifted. And there is so much information out there in the news. You can read blogs that talk about this, but it would be great if epidemiologists, infectious disease experts would really come out with almost a plan and a consensus that people could use on a very practical level. I think from what I've read in that vein, it sounds like as places continue to open up and you can expand your bubble in a way, you have to think about your own level of comfortability and examine what other people have been doing. If it's going to be other family members, how strictly are they observing safety measures? How safe do you feel in the environment? Will it be an indoor gathering or an outdoor gathering? So there are a lot of parameters to consider. We've been talking about states where the numbers are rising. In California, for example, there has been some data looking at where these rising cases are coming from, and in part it's from families getting together again. One case in particular I read about is a family who crossed state lines and they had a gathering, and this led to infections. But then we're also seeing it in places we'd expect, like skilled nursing facilities, even in jails. In a state like Arizona, there's some criticism that yes, while they did observe quarantine early on as the restrictions were lifted, the governor isn't wearing a mask, and people are sort of letting caution go to the wind, and they're not wearing face masks. They're not observing social distancing. Unless we really can firmly create a message that Americans can follow, I think we're going to continue to see more of the same, unfortunately.